These very signs that I'm going to be mentioning here or explaining here will tell you whether ovulation have taken place, whether you ovulated or whether you are ovulating. If you are having issue with ovulation, this video is for you. Hi, my name is Tochi and I welcome you to Tochi Fertility Channel. If it is your first time and you like what I'm doing, please like and follow our page. Subscribe to this page to support me if you like what I'm doing. In today's video, I am going to be explaining to you the signs that will tell you that ovulation have already occurred or whether you are ovulating or not. This video is very important for any TTC mother that is trying to conceive mother. Sit down and watch this video and learn about ovulation, which is the bedrock of conception. Now, let's get into it. What is the first signs that tells you that you are ovulating or ovulation have taken place? The number one is menstruation. If you are menstruating, you have higher chances of ovulating. In other words, many women who menstruate may not be ovulating. This is a different topic, but menstruation tells you that at least when you see that blood coming out every month in your cycle, it tells you that you have higher chance of ovulating in that particular cycle or that particular month. So if you are not menstruating, if your menstruation is not coming every month, just bear in mind that you are not ovulating and ovulation have not taken place. I am going to repeat myself. The absence of menstruation means that you are not ovulating. Yes, it is after the menstruation that the follicles will start developing, and during the time of ovulation, this follicle, this matured egg, will be released from your ovary. Ovulation simply means the release of matured egg, not just egg, but matured one. The egg must be matured before it will be released from your ovary. Please take your time and watch this video. I am taking my time to make it. Take your time to watch this video so that you will learn. If you learn these things that I'm teaching you, you will not find it difficult to conceive. Some of you will just click the video and start asking me questions. Please pay attention to this video. Learn more about ovulation and learn how to identify whether you are ovulating or not. That is why I am making this video. I beg of you. So I said the number one sign that will tell you whether you are ovulating or ovulation might have taken place is menstruation. If you are menstruating, then you have the chance of ovulating in that particular cycle. Another one is through ultrasound. You can use ultrasound to know whether you have ovulated or maybe you are ovulating. Majority women that are trying to conceive, their problem is anovulation. Their problem is anovulation. Anovulation is the failure of your ovaries to release matured follicles. So you are suffering from anovulation. I'm not saying that ovulation is the only cause of infertility. There are many causes of infertility, but the most difficult one is if you are not ovulating. Other ones can be easily fixed. But if you are not ovulating, there's no how conception will take place, because there must be an egg that the sperm will fertilize. Then this egg will implant, and you can say that conception have taken place during the ultrasound, or if you are using ultrasound to know whether you are ovulating or maybe ovulation have taken place. If you ovulated, if you have ovulated and you use ultrasound, your physician will be able to see the egg. The egg will be there. The egg will be there. I could remember, and this my last pregnancy, I never knew that I have taken in already because I wasn't paying attention to my body, as I can say, and I wasn't tracking anything. Although I know that I'm trying to conceive. I was planning. I have started planning to conceive, but I wasn't paying serious attention because it's just the first month that I started trying to conceive. So I wasn't expecting it to happen at one time like that. Although I did everything, I detoxified my system. I took clove water. I took my prenatal vitamin. Yes, you are looking at me. I prepare myself. If I want to get pregnant again this month, I know what I will do. I will prepare all these things that I'm teaching you people. They are effective. If you pay attention to me, if you follow my instruction, if you listen to my teaching, the problem people have, they don't listen. They don't listen. They will tell you they don't have data, but they have data to go and listen to gossip. Something that they cannot learn anything for, something that cannot impact their life. That is what people like watching. They don't like watching educational programs like this. So now I took all these things and I was having back pain, not knowing that it was implantation. Remember, I said I wasn't paying careful attention. Assuming I have tried for 3 or 4 months, maybe by then I would be too attentive, but I wasn't paying attention. So I went to my physician. I said, I don't know what is, my back is paining me severely. So when he used the ultrasound to check, he found out that he asked me, your egg is there. I said, egg? He said yes, ovulation took place and your egg, they wouldn't call it, they wouldn't tell you you are pregnant because it's too early to be called a fetus. It's just like egg. They will see it as egg, but the physician would know that you are already pregnant, but they wouldn't tell you that you are pregnant. They will tell you that you have ovulated. If you are not ovulating, the ultrasound will also say it. So if you are not careful, if you are not very sure, if you don't know how to calculate your ovulation or to know whether ovulation have taken place, maybe you should speak with your physician, your OBG, your healthcare provider, your fertility doctor. Let them use ultrasound to track your follicle to know if your ovaries are releasing matured follicle or even if you have eggs left in your ovary. Yes, this is another problem. I'm not going to be talking too much. So I said number 1 is if you are menstruating. Number 2 is the use of ultrasound. Number 3, you can use basal body temperature, because when ovulation have taken place already, your temperature will go up but later it will come down. If you ovulate, your temperature will go high and later it will come back. So this is also another method of knowing whether you ovulate or not. And this is a little bit technical. Somebody who is applying this method, you need to be careful, consistent, and you must be checking your temperature every morning, first thing in the morning before you wake up from your bed. So it needs attention. So another one is cramp. Sometimes some people say they are feeling cramp in their lower abdomen. And one thing that you know that differentiates ovulation cramp with other cramps like fibroid cramp, PCOS, endometriosis, ovulation cramp is mild. And it doesn't last long because this is just ovulation, something that is coming out when the egg is releasing. So the pains is not too much like the ones of fibroid or cyst. If the cramping exceeds 2 or 3 days, then you need to go to your doctor. That is no more ovulation cramp. Another sign or thing that will tell you that you are ovulating is cervical mucus changes. A lot of people do not know this, and if you are careful, if you are wise, if you are intelligent, I will advise you to apply this method. This is a very good method that can help you to get pregnant and also to know if you are ovulating or if you have ovulated. During your ovulation or even if the ovulation have taken place, you will see your cervical mucus changes. It will be sticky and clearer. You will not see any mix, pink or anything. It's just clear and it will be sticky like egg white. You will know this thing will come before ovulation, and after ovulation it will still be there but will not last long. So the next one that I can encourage everybody, every novice that do not know anything about ovulation, is the use of ovulation prediction kits, OPK. It's very, very good. It dictates your luteinizing hormone. It dictates your luteinizing hormones, which triggers ovulation. So when you conduct the test and you see the 2 lines positive, you know that you have ovulated or you are about to ovulate. Let me explain. When you are using ovulation prediction kit and you see both the control line and the test line positive, it means that maybe you will use it before your ovulation day. You see that the 2 lines are clear. It will be ovulating between 12 to 48 hours. Now, if this ovulation takes place again, if you do this test, it will be more clearer, very more clearer, and sometimes the test line will be more thicker than the control line. This shows you that ovulation have taken place. Another one is urge to baby dance. Some people, when the ovulation have taken place or before the ovulation, your body will be doing you like, you want to baby dance. You start looking for your partner. This video is long. I believe I have been able to do justice to this video. I beg you to watch this video. You are going to learn a lot from it. My new followers, oh my sweetheart, you are welcome. Like and follow this page, share it, recommend, and you guys will support me by subscribing to this page, and God in heaven will bless you and grant you your heart desire. I love you all. Bye-bye.